Welcome to A Healthy Dose of Humor, a podcast series that sets out to explore the intersection of humor and health. I've partnered with Leith, a creative agency with specialisms in advertising, communications, and health, to bring together patients, healthcare professionals, scientists, and advertising experts to debate and discuss all the ways that humor can help us communicate. So let's get stuck in. In this episode, we're going to look into addressing some of the myths around healthcare advertising and communications. And joining me to discuss it is Dan Wilks, director at Credos. Dan is a research and evaluation guru with over 15 years experience. He's laughing already. You look like a guru, though. Does that help?
Yeah.
You're very guru-like.
Thank you very
much.
With
over 15 years experience delivering quantitative and qualitative projects across the creative industries and government. With an extensive history of developing research and evaluation strategies for organizations, departments, and specific projects, he enables executive leaders to make evidence-based decisions, something the industry needs when being brave and bold with humor. Also joining us is Brian Cohen, a partner at Leith Health. Brian leads health work at Leith, overseeing the team that develops creative ideas to help solve problems at the heart of people's health. For almost 2 decades, Brian has worked on public health campaigns, bringing a passion for communications that encourage behavior change. From songs about poo to putting bare breasts on TV for the first time, he's been part of campaigns that have used humor to make us smile and make lives for the better. He's also a council member of the Institute of Practitioners in Advertising, ensuring Leith is up to date and following all latest advertising developments. Thank you both for joining me. Brian, you can't remember the poo song, can you?
No, not to sing it.
Not to sing it, no.
Test your poo. Yeah, there's some great lines in it, right enough.
Test your poo.
Test your poo. Don't be snobby, test your jobby. That's my favourite.
I mean, that is art at its finest.
Yeah.
With the Scottish, I'm pretty sure.
Yeah.
Wonderful. Well, welcome both of you. In fact, Brian, I think my first question is to you. Could you talk to me, given that you working in healthcare advertising for close to 20 years, tell me what sort of barriers have you seen when trying to engage in humor?
Yeah, I guess it's one of these things. There's a lot of different barriers or different things that come up. And I suppose at the start, as people tend to think of health as being a very serious topic. So I think there's that sort of sense of humor is just not appropriate when it comes to communications around health, that you don't want to use humor because it needs to be serious to match that. I think a lot of that can sometimes come from it being science-based. So particularly when you're working with companies who are either in the pharmaceutical industry or when you're working with healthcare professionals or where it's a policy or a government initiative, they're very focused on evidence and what works. And so from that point of view, I think their default tends to be the rational and to focus on facts rather than think about using something which might engage people more emotionally. And then I think sometimes there's this sort of sense of it being really sensitive as well, that you might almost like stumble across something, offend people and really put people's noses out of joint by using humor on a topic which is something which they feel should be dealt with more sensitively. And so I think it's become almost just like the norm. It's almost a sort of default. So I think particularly from our perspective or with the team, when you're working with clients and working on new campaigns or new initiatives, then it's just become the norm that humour is not something which we should start thinking about when we're working on our project. And so it's not so much that necessarily there's one single barrier. It's almost something that's just become accepted and people don't tend to question it. But you can see, I think, when you do question that norm, and I guess I was trying to think of a good example of where that norm has really been challenged. And there was a campaign a few years ago which was done in Australia and Melbourne, and it's around safety on public transport. So I guess if a definition of good health is, at least staying alive. And for years and years, campaigns around how to travel safely or avoid, accidents on the subway, etc., had been very much focused on scare tactics and really serious gravitas. And Then they brought along a campaign which was called Dumb Ways to Die, which was just a funny song. So it's just a really, really funny song. And it completely changed the norm and made people think differently about it. And I think that's still one of the most awarded pieces of creative advertising ever. Certainly at the time it was up there, everyone was talking about it. And I guess that's a good example where a sort of norm of seriousness, a norm of avoiding humour had been challenged and really just turned on its head to spectacular effect, really.
That's really interesting. So what you're saying is that you're finding that the barriers come with the client when they bring you their very serious issue, is that they almost say, but of course we won't be funny about this because it's inappropriate.
Yeah, I think they do. I think there's almost a reticence, or certainly, as I say, people feel that the norm is to not use humour when it comes to health. So that's the start point. And if that's your start point, you're not going to create an approach, or you're not going to begin to think of ideas or look for insights, look for information that can lead you towards a humorous ad because you think, well, actually, we don't want to go. That's just a place. Let's not go there. Let's not tell some jokes about this. Or actually, if you start off thinking, well, we should explore humour. It's not to say it always has to be a funny ad or always has to be a humorous solution, but it's got a role to play. And it's if you start the process, start the journey thinking about how can we use humour within this campaign, or how can we use humour on this topic or this issue? Is it the right moment to engage people using humour? Then it might just lead you to the most effective solution, the most effective ideas.
Do you feel that there's ever a time where humour would be inappropriate for the audience? Or do you think that because humour is just a part of the human condition that in some way, shape or form, it could always be utilised?
I think there'll be times when humour is not the right option, and it might be to do with the journey that somebody's on, or if it's a point in a diagnosis or a journey through a condition or an illness where maybe actually using humour at that point would just be, too close to the bone or not the right time to do it. But I think, we talk about health and we talk about health advertising, people always think about their health and think about it in an emotional sense because, basically people say, how are you feeling? I'm feeling good or I'm feeling bad. So it's that sense of that emotional journey that you take with your health and thinking about how humour can interact with that. And we know humour's the type of thing that makes people feel, you laugh, it's involuntary, isn't it? You feel something. It changes your mood. So I think it's just trying to tap into that. So there's times, sure, when it can be perhaps inappropriate or the wrong time to use it. But I think if you plan it well, think about it, and focus on the right moment, it can work very, very well for us.
I want to bring Dan in on this. Dan, tell me, both of you tell me. So you've brought up some of these barriers, which seem to be some misconceptions or preformed ideas that people have about when it is or isn't appropriate to use humor. How could you actually start to address those barriers?
Well, there's a really good quote by Peter Ustinov, isn't there, which is, comedy is simply a funny way of being serious. And I think that is so true. And you'll know, Ria, probably better than anybody, that a lot of the best comedy comes from serious issues that we face as individuals or as a society. And I don't see there's any reason why advertising can't apply to that and be the same as that. And Brian's right, it's the assumptions that brands and marketers come in with, is that, we can't use humour for serious categories or serious topics, or to drive purpose or to promote premium quality. But you can use humour to do all of those things. And there's plenty of examples to show where it does work in those cases. There's a great piece of work that Kantar produces in association with the Ad Association and Marketing Week, where every month we ask consumers, we look at a different media channel and we ask consumers, what's the best ad on this channel? And what's the most creatively effective ad on this channel? And we're doing it for a couple of years now. And unsurprisingly, humorous ads are winners nearly every month, time on time. And it's given us some really good examples of where these serious categories or serious topics can be addressed. So I think it's just about brands being brave. One example on a serious topic that was really effective was Here We Flow, and they did a campaign called Period Drama, and it's they're kind of a company that sells sustainable period products, and basically it was like a Downton Abbey vibes. There's all these aristocrats sat around a table eating and drinking, and the women around the table start telling funny stories about their periods, and it was the most effective TV ad for the middle of kind of 2022, and it had huge effects for the brand in terms of recall and remembrance and all of those sort of things that you associate with successful advertising. And it also had a score, and I love this phrase, I can't believe it's something that Kantar measures, viral pass along. Sounds horrendous, doesn't it?
Viral pass along?
Yeah.
Or it sounds like a dance you do, doesn't it?
Or
at
a
a
nasty,
ceilidh?
or something you catch, which is a bit nasty. But essentially, yeah, I mean, it's something that obviously works so well with humorous advertising. People, if they find it funny, they're going to share it and pass it along. Okay. And that worked so well for that brand. And it's a really good example of taking a serious topic, applying humour to it, and there we go. Successful advertising.
And hopefully successful revenue for the brand.
Indeed, yeah. Yeah.
So, I mean, what you've just told me there is a story about how humor was incredibly effective. So we're seeing that in the numbers?
Yeah, sure. Yeah. I mean, the data, when it comes to successful, effective use of humour, it's almost endless. And I've got a few stats for you. I'm going to throw them in there.
Throw me
You
numbers.
Love a stat, right?
I'm Asian. I love a number. Come on.
So 90% of consumers are more likely to remember a humorous ad. 72% of consumers are more likely to select a humorous brand over the competition. That's a couple of stats from the digital agency Oracle and some work they did. System One have a test your ad database where they kind of test all of the adverts that get thrown out there. And humorous ads score 5 or 6 stars on average, whereas a normal non-humorous ad are usually averaging around 2 or 3 stars. So it's really impactful on those creative, effective measures. And Kantar, they do a bit of research as well and found that humorous ads are more expressive, more involving, and more distinct. So I come from Credos, which is the advertising industry's think tank, and we've done a bit of research in this area, and we found that people who regularly laugh at ads are twice as likely to notice the advertising, 3 times as likely to remember the advertising, and get this, 4 times as likely to actually respond to the advertising, so either buy something or go and search for the product directly. But there is one other way that it's effective that I think really stands out for me and is maybe a little, you wouldn't necessarily associate it with humorous ads. It actually builds trust, both in the brand and the advertising. So at Credos, we've been doing a lot of work with the Ad Association about trust, and we've identified that the number one driver of trust in advertising is the enjoyment of the ads. So whether an individual enjoys the ads or not. And humour, there's 5 parts that basically make up a levers as to whether someone enjoys an ad or not. There's music, whether it's visually stunning, whether the ad is inspiring, whether it's moving, and also whether it's funny. And of those 5 levers, it's whether an ad is funny has the strongest impact on whether the ad is enjoyable. So there's that real, quite a clear follow through between humour equaling enjoyable ads, which then drives trust both for the brand and for the ad. And obviously for health, in the health category, trust is probably paramount, above other categories potentially.
That's really interesting. I mean, I'm convinced, and I have nothing to advertise. I almost wonder, I'm coming back to you, Brian, I almost wonder, should we be just presenting these statistics to brands straight away to go, before you say no to humor, let me show you what the stats are? Does that change their minds, or are they still reticent?
Well, I think so. And I guess that's what's the great thing about having this conversation today, is the sense that we're unearthing the facts, unearthing the evidence that says, actually, you should think about using humor. And I think the stats that Dan was talking around, in particular around trust, are incredibly powerful in that sense, that the connection that it can create with a patient or with, just with customers, or depending on what it is, whether it's a product or a service, or how you're, whatever it is you're talking about, it's got to be, that's really got to be fundamental for most organizations in health, is to feel that you really trust the organization that you're dealing with, whatever it is that they're offering to you. So I think it's trying to get people to think differently. Yes, surely we can share the information, we can share the facts and figures that make them think, actually, I should look at this again. And then I think it's partly about also sharing the great sort of funny ads that are out there, great, funny campaigns as well. And then once we can get into those conversations, then whether it's about taking, taking clients, taking people on the journey with us as well. I think so that people understand actually you've got to go through this process, and this might be where we end up, and maybe you might feel a little bit, uncomfortable about it, but that's okay. It's okay. We'll hold your hand and make sure it's a good experience. So yeah, I think we can do that.
I think another slight misconception as well is that with clients is that when you talk about humorous ad, they immediately think of TV. Which makes a lot of sense because obviously that's been traditionally the medium where it's most effective. But obviously it can be very effective across all mediums, press, outdoor. Radio actually has the highest proportion of humorous ads of all of the media channels, but also digital. I mean, it's very important that the humorous ads follow through on that medium. And there's one example that I found from Tenor Men actually have a campaign called Legend, and which is addressing incontinence in men. And I can't think of a topic I'd rather less engage with or talk about than, men weeing themselves. But this was a 15-second campaign that only ran on digital. And I think it won Kantar's Creative Effectiveness Awards for 2023. So it was short, only ran on one medium, but was the effectiveness measures around it were huge. And it was just 15 seconds of perfection for a humorous advert. So yeah, definitely one to check out and a good example.
I think we have 15 seconds. Do you want to give us a vague idea what was in it? I mean, that was the biggest dangle of a.
It's really hard to explain actually. There's just a guy who looks like a bit of like a legend. He's got a bit of 70s vibe going on, a bit of a tash, and like you're just looking at his face. And it's focusing on his face, and he's quite chiseled. And then he kind of stands up, and he's just got this pair of briefs on, really tight briefs with the Tenor pad in there, quite visible. And he's kind of saying, "Hey, now we're all friends. Let's talk about male incontinence." And then he just goes into it, and it just sets it at ease. And I don't know, it's hard to explain, but I guess
the thing about that campaign and the way it uses humor in a great way, because it makes people feel like they're on your side, and it's that sort of sense of you create that empathy and recognize that, as you say, it's not a topic any man wants to talk about, I guess. But with the way they've done that, and I guess one of the things I thought was so successful about it was to just really empathize and said, actually, now that we're all friends, so it's like, we're on your side, and yeah, this is awkward, but let's just get out there. And so great, I guess that's breaking that taboo, breaking the norm of thinking you can't use humor for that type of product. You can imagine not so long ago that would have been a rational demonstration of how effective that product was and how it worked and so on, and all these messages that you just think, is that really what I'm feeling when I'm seeing that ad? It's actually kind of uncomfortable. Get into that uncomfortable space, and then people are much more likely to engage with you.
Pouring blue water on it to show how absorbent it is. Yes. As a woman, yes, I've seen those ads in those days, and then
they've gone. Yeah.
Did he roller skate? No. Wow. See, they missed a trick there. But in the next one, in the next 15 seconds, he can roller skate.
Yeah. That'll be even funnier. Yeah.
Well, I mean, if we can roller skate with our pads, I'm sure that he can with his. So that's wonderful. So there's a number of ways that humor actually can help overcome all of these barriers. But I suppose people listening will really want to know how. For those who haven't really approached this in their work, or have stuck with the assumptions that it isn't a good idea, and they haven't really got the experience of how to use humor in their product, how can we start adding more humor into the work that's being produced in this arena?
I think and the start of using humor is to really think about being almost as truthful as you possibly can. So I guess that Tenor example starts with a truth and starts with something that people can really identify with. And I think it's trying to focus on what are those truths that are, kind of universal to the topic or the issue that you're focused on. And the best way to do that usually is to speak to people in the audience, speak to the market. Let's not try and write it at a distance, or let's not try and think that we know all the answers, but get involved with the customers, with consumers, with people who are experiencing that health issue, and speak to them and hear how they talk about it, and build up your campaign from that start point. I think it's also interesting when you test, because you always, when you research work or research creative ideas, I'd be interested, Dan, to see how you think about this, or what you think about this as well. But I think it's often the case that research kills ideas if it's not done sensitively, because again, when you speak to people and say, like, we're going to make a funny ad about cancer, and people say, oh no, you can't do that. And especially when you speak to people who maybe haven't had cancer or haven't had someone close to them affected by it, said, oh, you can't possibly do that. You can't make light of that topic. But when you speak to people who actually have had cancer, or people who have experienced a particular health condition, they say, well, if this gets other people to act, particularly around early stage detection or around intervention, they'll say, by all means use humour, because if that's what works, then use humour. They don't feel offended by it. So I think it's designing, involving patients, involving people, and talking to them about their experience, and then designing a sort of testing program or research program which really makes sure that can come through, so it doesn't just get choked off because of the norms that exist. But yeah, I don't know, Dan, if you feel when you're testing or researching how's best to do that.
I mean, it's just about trying to be as natural as possible and put the research participants at ease. And if you can get someone who's like interviewing them or doing the research, who's got a bit of experience with the issue at play, it's obviously not easy to find that necessarily, but that makes a massive difference. But it's also, like you say, not tackling it direct, right? Talking about their experiences and getting them talking about their experiences. And no matter how serious the issue is, whatever sort of serious issue we're looking at, there will be humorous elements to it. So if you get people talking about their experience, they will naturally surface. And once they've been doing that for a while, you can then introduce the idea of humorous adverts and how they think about that. But as I say, if you just talk about the experiences, the ideas for how you bring humor into these types of adverts will emerge naturally. My dad's got Alzheimer's, and I'm really tuned into this at the moment. And I don't know if you saw, the Alzheimer's Society just did an ad recently, which is an absolute killer. I mean, if you don't just absolutely break down in bits watching it, then I'm not sure you're really human. And it's great, it does exactly what it needs to. But I'm still waiting for the humorous ad about dementia, because there's so many funny elements to it. You know what I mean? Every day when I see my dad, he does something which is so ridiculously funny that you're just in bits. I've got quite a good story actually, which was one of the funniest things that I've come across, is that he woke up one morning in bed and he said to my mum, I think I'm dying. You've got to get an ambulance. You've got to get an ambulance. And she's like, why? What's wrong there? He's like, I've got a headache. I'm sweating. I feel sick. I don't know what's going on. You need to get an ambulance. She said, you've got a bloody hangover. And he'd been drinking the night before, but had absolutely no idea that he'd been drinking. So you can imagine waking up with the symptoms of a hangover, but not knowing you'd been drinking. You would be seriously worried. So, there's stuff like that, which is absolute comedy gold. But as Brian points out, it is difficult landing it correctly. But there's so much comedy in all of these serious issues that tapping into them from people's experiences it is key.
I think that's a really interesting example that you give, because you're living that experience, you're finding those areas of humor. And I think a lot of people in that world would agree with you that there are things that everyone in that situation will laugh at. But as someone who sits outside of that situation, I don't have dementia in my close community, I would be very hesitant to be seen to be laughing at your father as opposed to with your father. And I think that's a key difference, isn't it, is whether we are laughing at or with a community, and it's striking that tone.
I think it is. I think being, self-deprecating, or making sure that, the brand or the organization, whoever's doing the advertising, feels like they're part of it as well. So I guess thinking about comedy, and the best comedy is often that way, isn't it? It's, the routine or the stand-up that's making fun of themselves or making fun of their story. And I think as long as we can try and keep in that territory, I think it's helps avoid people being offended or feeling like actually that's not, it's not a real experience. Well, I think it's interesting, that sense of as well around if people have moved on, that the kind of really emotional health advertising has been, fantastic advertising that's been done for a number of years, but possibly it's a moment now as well to move on from that and to think about a different way to engage with people, a different way to get a message across. And there's only so much of that sort of heavy emotional, as you say, Dan, you kind of leaves you in bits. And is that necessarily the way you want to feel, or is that the best way to get you to change behavior? And I think it's interesting just to think about that and think, well, is this a moment now around health and around humour to think, how can we do things a little bit differently as well?
It's that interesting point about the Alzheimer's one, actually, as if I think for someone who's not involved in dementia, it would be totally eye-opening to like, oh, wow, I didn't realise that. That's how the reality of living with it. But for someone who is in it, I was just like, I don't need to see that. You know what I mean? So it was one where actually being in it, it probably didn't work as well as being outside of it. But very effective and very well made, a great ad. But yeah, like Brian says, there are alternatives out there that could be explored.
Well, that's a classic example, what you've just said there about who is your audience.
Yeah.
Is your audience within or without the community that you're targeting? And therefore, when do you use humor? As you're saying, the Alzheimer's Society decided to use that other lever, which is move. Does it move you? Yeah. And it's a very moving ad. But it's targeting people outside who have yet to come across it, that need to understand what to look for and what the sort of devastations of it are. Whereas once you're inside it, as you are, you're finding a lot of humor in the situation. Yeah. So in summary, in terms of talking about barriers to humor and some of the myths around healthcare advertising. So the biggest myth that we've covered is the fact that you shouldn't use humor when discussing healthcare and using it in advertising. In fact, you should. And the barriers to using it seem to be people's misconceptions or assumptions that humor cannot be used effectively in the situation. But what we've seen from the research is that actually humorous advertising is incredibly effective at getting people not only to pay attention, but to remember it and to act, to change behavior. So to those listening, in terms of asking how to then start using humor if you haven't used humor before, what we've heard here is that the key thing, which is so important for tone and for just hitting the mark, is to do your research and to go to the community that you are trying to raise awareness for and make sure that you are hitting the mark correctly. And just keep asking those questions and testing and making sure that it's okay. But obviously, as you said, ask the right questions, because if you ask the wrong question, it might shut it down before you even gotten started. Thanks again for joining me on A Healthy Dose of Humor. And remember, if you're interested in hearing more about the topic of health and humor, or connecting with any of our series contributors, you can access all of that and more at leith.co.uk/healthydose.